What's up, YouTube watchers? My name is JT and I have multiple sclerosis. Today we're going to be talking about spinal stenosis. Yesterday I went to my neurologist and he was showing me pictures of my x-rays of my neck and my spine. I already knew that I had spinal stenosis, but apparently it has progressed some. So my neurologist gave me two options. The first option is to leave it alone and to see if it progresses more. I could lose feeling in my arms, my legs, or my whole body. The second option is I could have surgery on my spine. My spinal stenosis is about right here in my neck. He would have to do surgery on that area. And I've had a lot of surgeries, especially on my left hip, but this surgery seems very serious, and to be honest, I'm kind of scared. My neurologist has referred me to a specialist that will be doing the surgery if I decide to have the surgery done. Now, I'm going to be doing a lot of thinking about this, a lot of soul searching. I'm going to do a lot of research on this doctor and looking at the reviews of the people that have had the surgery done. Now, I have a procedure that I have to have next week, which is a colonoscopy. Gross. TMI, right? So we're going to be watching a video of the cervical spinal stenosis from a doctor from a Mayo Clinic. Let's go.
Hello, I'm J.D. Bartleson, a neurologist at Mayo Clinic in Rochester, Minnesota. I spend about half of my time seeing spine patients in our spine center. Today I would like to talk to you about cervical spinal stenosis. By cervical spinal stenosis, we mean narrowing of the spinal canal in the neck. This occurs when there is overgrowth of bony spurs, bulging of discs, and thickening of ligaments. Cervical spinal stenosis is important because the cervical spinal cord runs through the neck, and this vital structure carries all sensory messages from below the neck to the brain and sends all motor messages to the body through this same structure. Why is this an important condition to talk about? Because it's very common. It's estimated that over the age of 50, at least 5% of us will have significant cervical spinal stenosis that impinges on our spinal cord. It's the most common cause of myelopathy. By myelopathy, we mean spinal cord damage in adults. It's much more common than conditions like multiple sclerosis or acute traumatic spinal cord injury. How is it diagnosed? Magnetic resonance imaging, or MRI, is the diagnostic test of choice. MRI can tell us if there is narrowing, stenosis, and it can also tell us if there is impingement on the spinal cord. But the MRI can't tell us if the spinal cord is working well or not. For that, we have to rely on the patient to tell us about symptoms they may be having, such as weakness or clumsiness in their limbs, loss of sensation, pain in their neck or upper limb, or difficulty controlling their bowel or bladder. On examination, we look for weakness, evidence of spasticity, and heightened reflexes. Well, how is cervical spinal stenosis treated? If the patient does have impingement on their spinal cord and signs and symptoms of spinal cord dysfunction, then surgery from the front of the neck or the back of the neck can be performed to relieve pressure on the spinal cord and restore lost function in half to two-thirds of patients, or at least keep them from getting worse. However, if the patient has cervical spinal stenosis and they do not have evidence of spinal cord dysfunction, they can be simply observed and advised to avoid head and neck injury. When I tell patients that I recommend that they avoid head and neck injury, they often laugh at me, but there are some specific things that I tell them that they can do to help reduce the risk of a spinal cord injury that might, on top of their cervical spinal stenosis, cause cervical spinal cord damage. These include safety-proofing the home, using a nightlight, for example, avoiding loose rugs, avoiding slippery surfaces or uneven surfaces in the home, wearing proper footwear, avoiding hazardous activities such as downhill skiing or fast bicycle riding, avoiding going up on ladders, taking care with use of medications that might cause imbalance, like sleeping pills or muscle relaxants, and being careful in their use of alcohol. I also tell them to drive large car with plenty of airbags and drive defensively. Well, what about prophylactic surgery for cervical spinal stenosis to prevent myelopathy? This is a common scenario that I see in our spine center at Mayo. A patient has some neck pain, and maybe they have intermittent numbness and tingling of one or the other hand. This leads to an MRI. The MRI shows cervical spinal stenosis. This leads them to a spine surgeon who recommends urgent spine surgery to prevent a spinal cord catastrophe. The patient then seeks out a second opinion in our spine center. We see the evidence of cervical spinal stenosis, but their symptoms don't suggest any problem with their spinal cord function. Their examination is normal. And in this setting, we often recommend observation with avoidance of head and neck injury, as I mentioned before, and we often see them in follow-up in 6 or 12 months. The data just doesn't support operating on cervical spinal stenosis in the absence of spinal cord injury. Thank you very much for your attention.
So now that we know a little bit about cervical spinal stenosis, like I said, I got to do my research before I, decide whether I'm going to get the surgery done or not. Because, I mean, the surgeon could, like, hit a little nerve and then I'd be paralyzed and that'd be it, I'd be like, yeah, it's crazy to think about. But, all right. Thank you guys for watching, and I'll see you next time. Later. Oh, yeah. By the way, subscribe and like the video. Thank you. Peace.